Many people hear the terms arthritis and arthrosis and assume they mean the same thing. They are related, but the terms arthrosis is a little outdated. Hi, my name is Dr. Marc Gruner. I'm a board-certified sports medicine physician. So what is arthritis? Arthritis is a broad term that simply means the inflammation of a joint. Today, doctors use this word to describe more than 100 different joint diseases. These conditions can affect the cartilage, bones, ligaments, and the linings of the joints. Some types of arthritis are inflammatory disease, meaning the immune system attacks the joints. Examples include rheumatoid arthritis and psoriatic arthritis. These conditions often cause joint swelling, warmth, redness, and stiffness that can last for a long period of time. Other forms of arthritis are due to joint damage or the lining of the cartilage over the joint. The most common example is osteoarthritis, which affects millions of people as they age. Because arthritis includes so many different conditions, doctors usually describe the specific types of arthritis when making a diagnosis. Now, what is arthrosis? This is sometimes called osteoarthrosis, and it's an older medical term. It was historically used to describe joint disease, which means joint damage caused by wear and tear over time. In arthrosis, the cartilage that normally cushions the end of the bones begins to break down. Cartilage acts like a smooth surface that allows bones to glide easily inside a joint. When it wears away, the bones could cause pain, stiffness, and reduced. For many years, doctors believed arthrosis was a purely mechanical problem caused by aging and joint use. Because of this idea, the term arthrosis was used to separate degenerative joint disease from inflammatory forms of arthritis. Modern research has shown how doctors understand the disease today. This is more of an inflammatory condition. The inflammatory condition plays a role in osteoarthritis, which is why it's once considered simple wear and tear is now considered by most experts not just arthrosis, but also an inflammatory disease that is what we call arthritis. The discovery has blurred the old distinction between arthritis and arthrosis. So how do doctors like me use that today? In modern medical practice, the medical world arthritis is used as an umbrella term for nearly all joint disease. The arthrosis is rarely used anymore, especially in clinical settings. Instead of saying arthrosis, doctors usually specify exact condition such as osteoarthritis, rheumatoid arthritis, psoriatic arthritis, or gout. This approach is a better approach because it describes the actual cause of the joint problem rather than using a general label. Inflammatory arthritis often causes long periods of morning stiffness, sometimes lasting more than an hour. Your joints may feel warm, swollen, and tender. Blood tests of the joint fluid may also show signs of inflammatory osteoarthritis. And osteoarthritis tends to cause shorter periods of stiffness, often lasting less than 30 minutes in the morning. The pain usually gets worse with activity and improves with rest. The joints may feel stiff or enlarged, but are often less warm and swollen than inflammatory arthritis. Today, arthritis is the main term used to describe joint disease. Understanding the difference helps patients better recognize which symptoms are the right for treatment when they're thinking about treatments for their joint health. What questions do you have about your health? Drop them in the comment below, and I'll do my best to answer them in a future video.